So for 15 years now, I've helped a number of our dentists, first of all starting with myself when I moved from the transition from an NHS into private practice. And following that, so many of our dentists that have come through the Pain Free Group have transitioned in from starting off in the NHS and moving into private practice. And time and again, we've shown how that can be life-changing, where you have more time to treat your patients, more clinical freedom, better remuneration for yourself, and a healthier work-life balance. And what we see is that oftentimes dentists are ready for that change. They feel that the NHS is kind of grinding them down by the bureaucracy chained to that, what we know as dentists as a failing system and the number of challenges through no fault of the dentists that work in it. And from the GDC leading to more of those challenges and leaving at times dentists vulnerable to the litigation due to the time pressures to try and make the NHS system work, and that can lead to issues around fitness to practice. We know that demand for private care and what private care can deliver differently to what the NHS offers, and those patients are actively seeking that, and we have a dedicated system, process and patient experience that drives that forward as much as possible. And at the same time, it can often look like NHS practice is a safe place to be working in dentistry. But the reality is that with the costs rising, many NHS practices are struggling to invest in the practice, to stay at the cutting edge and be at the position where dentists want to be providing the best possible care to their patients. And that as reality is that that's a real challenge within NHS practice at the moment. So our mission within the PFD group is simple. We want you to really fall in love with your dentistry again, really enjoy it. Our dentists that provide great dentistry to their patients, they really thrive, they're engaged, they enjoy, they deliver great care and great patient experience. And we have a pathway to help you flourish with that. Whether you are experienced in delivering highly complex types of treatment plans, or you are a younger dentist just in the kind of early years of your career looking to make those steps. We really want to help you flourish as a clinician, and many of those dentists who came in from NHS into private practice have now moved on to become equity partners within our group. And so it really gives you that pathway, if you so choose, to really help your career flourish, as I've said. But we know that moving away from the NHS is a big decision, and that's why we've created this guide. Have a read at it. We really want to help create some clarity into kind of bite-sized sections for you, so you can plan carefully and confidently and have any conversations with our team and allow us to help you make that transition as you come out of the NHS, move into private practice alongside our group, to give you that pathway so you've got real clarity on where you're going and what the outcome at the end is going to look like for you, so that you feel confident and clear and you're able to take those steps forward.